Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Senator Nguyen.
Here.
Senator Stone. Senator Titus. Chair Doniate.
And I am here, and please mark Senator Lang as excused. Good afternoon, everyone, and welcome to today's Committee on Senate Health and Human Services. Today we have a bill hearing on AB 202, 265, 311, and then our work session. So the goal right now is to start, since we have all the members here present, we're going to start with the work session, and then we will move on to
We don't have all the members there.
Senator Lang's excused. She's not going to be here today.
Oh, okay.
Yeah. We will do the work session first, and then the order of the bills that I have are AB 265, followed by AB 202, and then AB 311. So that's the order that we have right now. If, as many of you know, we have the Senate versus the Assembly softball game today, so we're going to try to finish as fast as we can. If we don't, we might have to roll the bills up until the next meeting, but just want to give everyone a clear heads up and not try to throw a curveball. Before I start, I would like to make several housekeeping announcements.
That was good. That was good.
Agenda items may be taken in a different order than listed. We ask that folks keep their public comments short and brief and be kept to 2 minutes each so that everyone interested can speak. For the sake of time today, every presentation will be limited to no more than 10 minutes, followed by 10 minutes in support, opposition, and then neutral. So each of those three sections will get 10 minutes. And then obviously we ask everyone to keep their minutes 2 minutes, their public testimony 2 minutes each. You could also submit your public comments in writing to our committee staff. And if you do not wish to testify, we ask that you please still sign in so we can keep a record of you. And a reminder for folks that if you're here, to make sure you turn on your microphone on to speak and off to listen. And anyone who wishes to receive the copies of the committee's exhibits should go to the Nevada Legislature's website. And finally, we ask everyone to please turn off your electronic devices. So let's go ahead and proceed with the work session. We have two bills to be on the work session today. We have AB 206 and AB 289. So I want to go ahead and start with AB 206, and we'll go ahead and turn it over to our policy analyst, Ms. Cooper.
Thank you, Chair. Destiny Cooper for the record. As a disclaimer, I cannot advocate any measures you will hear before you today or against them. Assembly Bill 206 was heard on May 9th. It adds a 12th member to the Nevada Commission for persons who are deaf and hard of hearing, who must be a registered sign language interpreter and possesses certain experience and knowledge. Thank you.
Thank you so much. The motion for this one is do pass. Do I have a motion?
So moved. Second.
We have a motion from Senator Nguyen and a second from Senator Titus. Any discussion? Any questions? All those in favor, please say aye. Aye. Any opposed? Motion carries, and I'll send that floor statement to Senator Nguyen. Moving on to Assembly Bill 289. Ms. Cooper.
Destiny Cooper for the record. Assembly Bill 289 was heard on May 9th. It authorizes the use of natural organic reduction for disposing human remains, which is the contained accelerated conversion of human remains to soil. The Nevada Funeral and Cemetery Services Board may adopt regulations governing natural organic reduction. The bill includes natural organic reduction in the definition of cremation, thereby applying existing penalty provisions for violating requirements governing the disposition of human remains and the licensing, permitting, and certification of operators and facilities for the deposition of human remains. Thank you.
Thank you so much. The motion for this one is do pass.
So moved.
Well, we got a motion to do pass. Do we have a second? We have a second from Vice Chair Nguyen. I think also a record for how fast I've gotten a motion this session.
I'm making my new arrangements next week, so.
And then, so any discussion on the motion for this bill? Seeing none, all those in favor, please say aye. Aye. Any opposition? Motion's carried. I'll go ahead and assign that floor statement to Senator Titus.
Yes. Thank you.
Thank you so much. That concludes today's work session, and we will now move on to the bills that we have for hearing. We're going to move first to Assembly Bill 265. This bill revises provisions relating to mental health. And with this, we have Assemblywoman Gorlo. So please proceed when you're ready.
Thank you so much, Chair Donate and members of the Senate Health and Human Service Committee. For the record, I am Michelle Gorlow, and I represent Assembly District 35 in Clark County. And I'm pleased to be here today to present Assembly Bill 265 for your consideration. And with me today is Dan Musgrove, the immediate past chair of the Clark County Children's Mental Health Consortium. AB 265 will establish a state children's mental health consortium, which will assist in organizing the regional mental health consortiums and provide an opportunity to collaborate with each other and coordinate mental health services for children. And that's my part. With that, I am now going to turn over to Dan. I told you I'd be quick.
Thank you, Chair. Dan Musgrove, today representing the Clark County Children's Mental Health Consortium. Past chair, I want to first thank Assemblywoman Gorlow for the big part that she plays in children's mental health. She has been an active member of our Clark County Consortium and brings this bill today to you to create the statewide consortium. If I could, I'd like to give a little history of what the consortiums are. They were actually created by this legislature back in 2001. Wall of Distinction Speaker Barbara Buckley created the consortiums through AB 1, which was a bill that was created to end the bifurcation of child welfare. And as a part of that bill, she thought it was very important to create the mental health consortiums for children to make sure that the needs of children were addressed. And the neat thing about the statutory makeup of the consortium is that it really brings folks from a lot of different silos, different agencies, different perspectives all together in one group. We all serve voluntarily, and with our focus being what is in the best interest of children and their mental health. I'm wearing green today. This is Children's Mental Health Acceptance Week, so it's very appropriate that we're here today. You know, in the 1800s, green meant that you were insane. It was a symbol of someone being insane, and we obviously have come very, very far from that. And now it means to children's mental health, it means to mental health that it's all about acceptance. It's about a new beginning and focusing on the health of folks when it comes to their behavioral health needs. And so what the Children's Consortium has done, and statutorily we have three created here in the state. We have the Clark County Consortium, we have the Washoe County Consortium, and we have a rural consortium. And like I said, the membership is very specific. We have someone from state agency, the county agency, we have parents with children with mental health needs, we have a foster parent that serves, we have a person like myself who represents the business community. And I think the really only reason they asked me was that I could help them in the hallways of this building to get their message across. But I have been working in mental health for a very, very long time, and I'm very proud to serve as a part of the consortium. But however, there has never been a statewide consortium in statute. Now, informally, we have had a statewide consortium for longer than I've been involved, and that's been about 9 years. But again, it's really just because we've had cooperation with DCFS at the state level. We've had people willing to serve, but we thought it very important to memorialize it because we believe the statewide consortium fills a very important need. It brings together those interests of a very diverse state. Obviously, the needs of the rurals are potentially different than that in Washoe County, and certainly that in a large urban county like Clark County. And it's important to, again, make sure that we are working together, that we're not working against each other, and that we work as a unit to, again, get our message across to not only the state, but county agencies, as well as this legislative body to ensure that the best interests of children are considered, whether it's in the school districts, whether it's in the juvenile justice system, whether it's child welfare, or even just as the public deals with these kinds of issues. And so 265 is in front of you today. What it does is it sets up that framework of what the statewide consortium should be. In the first section, actually it's section 2.5, it talks about making sure that the chair of the statewide mental health consortium plays a part in the behavioral health commission that already exists. And then further on, it sets up the membership of who should be on the statewide consortium. And again, we want to ensure that there are folks that are coming from different interests, different perspectives, that to ensure that, again, we are seeing what is completely the environment of what children's behavioral health might be, whether, again, like I said, juvenile justice or the school district or again, different counties across the state. And then it also requires that we do some reporting. And I ask that it be included on Nellis. You'll see the 3 consortium reports that were just recently finished by the rural Washoe and Clark. You can see what kind of extensive work is done by each of those entities. And so the statewide consortium will also have a responsibility to look into what is happening statewide, provide that reporting both to the state and to the legislature. And again, we feel that's very important. And then it also gives us the opportunity to bring a bill draft. Because sometimes we are not able to gain a window for sponsor like Assemblywoman Gorlow to bring our issues to the legislature, and we would like the opportunity to have bring a child-specific behavioral health bill to the legislature every session. And really, that's the bill. Again, the consortiums have been such an important part of framing up and making state policy since 2001. And it's only through the fact that we work well together, but we want to certainly ensure that the state and the department, DCFS, continues to recognize that a statewide consortium is necessary, and we want it statutorily defined. And that's our bill.
Thank you so much. I appreciate the presentation. The first quick question that I had before I let my committee members ask any questions. In reviewing, let's see, what section is this? I'm looking at page 4. I think, what is this? Section 7, subsection 4B. What? No, hold on. I'm looking at the wrong one. 1 second. It's actually page 7, section 9. So it's section 9, subsection 2B. Review, make recommendations for and approve programs proposed by the division to prevent placing children, et cetera, et cetera. So I don't have any heartburn over the make recommendations, but I think the approval process is one that I am a little bit skeptical of, just because, as you may know, our systems in place sometimes don't meet as often because of the infrastructure that we have. And so maybe if you can elaborate as to why this body would review, make recommendations and approve, specifically, and approve some of the programs and initiatives, I think that would be helpful for the context.
Dan Musgrove, and I may end up having to phone a friend behind me, but you know, the approval process, I think, is more of an internal to take a position. I'm not sure that we actually have authority to stop something that DCFS would be implementing. But I think it's important for us, you know, especially as the DOJ is looking at what the state has done. And this particular category, talking about, you know, children in facilities located outside of the home or home stay of the child, is certainly something that we need to focus on and really, you know, look at and try to do the best that we can to ensure that this doesn't happen. And so when we're talking about programs, I think really it's more, what's the best word to say? Recommendation. I mean, it really is a recommendation from the statewide consortium, and we do meet actually every month, unlike other boards. In fact, that would be a requirement that we do that.
Yeah, so thank you so much for that. I think to make it easier, I would just prefer to just structure that sub-bullet point as make recommendations for programs proposed by the division to prevent, et cetera. So just rewording it to just strictly say make recommendations. I don't know if other committee members feel that way, but that was pretty much the main thing that I caught. And I don't know if you wanted to make any statements as well.
Hi, thank you, Chair Donate. Shar Frost for the record. I'm a member of the Clark County Children's Mental Health Consortium as well as the state consortium. And the reason that verbiage is in there is to make sure that we have multiple lenses looking at these programs, because we should be really operating under that system of care with that family-driven, youth-guided, making sure that all of those perspectives at our table, which includes foster parents, as Mr. Musgrove said, as well as business representatives, therapists, community therapists, as well as the state, that we're all at the table making those decisions together so that we come up with the best quality, best practices that we can for the children of the state and the families of the state.
Thank you, Ms. Frost. Senator Tice, did you have any questions? Go for it.
So thank you for being here. I do have some concerns. One of mine was that very issue about putting you in a position to approve what the department's doing. So I have some concerns about that because we have a process on regulations, ledge ops, et cetera, and oversight. So that was one. So thank you for asking that question. I am concerned about yet another commission, as I've testified before on this committee and in other committees. But even more concerned that I sit on the Northern Nevada Behavioral Health Care Policy Board. We recognized on 2017, I think it was first started, that mental health issues in the state, there's some general state components to it, but each district has its own uniqueness. And so it was important to solve some of these mental health issues by, at first we had 4 districts, now we have 5 districts, because they're all so unique. And each one of those boards gets a bill. And trying to solve the mental health. And we've addressed on all the meetings that we have, it's mostly monthly. Children is one of the things we talk about. You currently have, as you testified, 3 children's consortiums, the Clark, Washoe, and Rural. How, in my mind, this is duplicative. And I worry that now you've already recognized way back when that the state isn't the one that can really solve some of these issues, that it's better, the more smaller, the local you can get it, I think the better. So I worry that now we're creating a state body. I'm not sure how it will interact with the 3 consortiums that you have, plus the behavioral health districts that you have. And so yet you have another floating organization up here with actually some authority because they have to now approve some of these programs. And so I'm just concerned about it's going to interfere with as opposed to problem solve.
Thank you, Senator Titus, for the question. Shar Frost again for the record. I am also the chair of the Clark Regional Behavioral Health Policy Board, as well as being a member of the Clark County Children's Mental Health Consortium. At the beginning of, I was one of the first people on that particular board. Mr. Musgrove now sits on that board as well. And I serve as the family and children, or family and consumer member. So we recognize that, and I know how much work I do on my own time for the board. However, we have very large issues in the state with mental health, and the children's consortia are really critical because we cannot treat children as little adults. We have to treat the entire family, and quite frankly, the Clark Regional Behavioral Health Policy Board has deferred to the consortia for as far as our priorities relating to children. And, quite frankly, there have been several bills this session, actually several bills throughout since the Behavioral Health Policy Boards came online, and none of them deal directly with children. We used to have a bill draft request for each consortia. That was stripped from us. I'm not going to remember the session, but it may have been 2015, 2017, somewhere in there. And we didn't always utilize that bill, but we would like the ability to utilize that bill draft request again when there are, and again, this would have been coming out of this DOJ investigation and even going into the DOJ investigation. It would have been nice to have a bill to address some of these really large issues for our children, because eventually they're going to become adults, and we want to relieve some of the adult stressors by getting kids early and treating them when they need to be treated in the way they need to be treated.
Thank you for that follow-up, Mr. Chair. So thank you for that. Thank goodness we passed a bill last session that allows people to be on more than one board, because prior to that, you could only be on one. But then we found that we didn't have enough people on board, so obviously both of you sit on a couple. Following up to the bill draft request, so because each one of the 5 behavioral health districts gets a bill draft, you're proposing that this statewide children's consortium will get one bill draft, is that correct? And then you just testified that the 3 current consortiums do no longer get a bill draft, correct? And I don't see anything in this bill that says that you work with or consult the three existing consortiums. Is that something I missed, or will you work in tandem and listen to them on if they had a bill they would like to do? Again, just some clarification here.
Chair Dan Musgrove. And those are great points, Senator Tice, because I think where you may have missed it is it's important to look at the membership. The membership makes sure that there is a member from each of the three. And I will tell you that each of the three consortiums are absolutely supportive of having a statewide consortium, because it is important for us to get together and to make sure that we are understanding what each region and each county is facing. It is unique, but sometimes it is very, coincidental and same thing that each of us are all dealing with. And so we don't have any concerns that there's going to be any inability to agree on one bill draft. I mean, yeah, would we like more? Absolutely. But I think to Ms. Frost's points, children's issues are very unique. And of what the 5 or 6, whatever there are now, of the regional policy boards, not one of their bills really focused on children, because I think most of them, and I'm not sure about the board, you have yielded to the work of the consortium because they have been in existence for a very long time, and they do an incredible work. And I think if you would look at our reports, you see the depth of research and assessment that we do in our own communities to come up with these reports. And we've always felt that the statewide consortium is better placed to kind of be that one voice for children in these kinds of environments, whether it's the Commission on Behavioral Health or when I've brought the reports to the Interim Committee on Health. It's always been on behalf of all three consortiums. And I think that has always kind of been what we're proud of, is that we work so well together. And we just wanted to formalize it.
Can I just add one more thing? So the state consortium, I'm sorry, Char Frost for the record. Thank you for the question, Senator Titus. I think it's really important to note that this statewide consortium has been operating. We've been operating under open meeting law. We have been in existence for at least 10 years, if not more. And the reason that has been is because we wanted to make sure that we weren't advocating at cross purposes by region. And so if there's something going on specifically in a region, and I'm lucky enough to be able to attend each of the consortia monthly, but we want to make sure that we are supporting one another and addressing those individual needs, because we are very, very well aware that the issues in the rural and our frontier counties are very, very different than the issues that we have in our more populous counties. Thank you.
Thank you so much. Any other questions, Senator Stone?
Thank you. I appreciate the presentation, and I, like Senator Titus, don't like to see a lot of duplicative commissions, but I don't see this as such. I mean, when you're dealing with a state that has significant issues with our foster care programs, behavioral health, substance abuse in children, and knowing that we have 3 geographical areas of this state that are very much different, and having a representative each on this statewide commission, I see it as a great advantage to try to come up with an additional solution, even if it means an additional BDR for us to consider. So when I review the section that our chairman was referring to, section 9B, review, make recommendations for, and approve programs proposed by the division. So I don't interpret this to mean that the division has to follow the recommendations. These are just, they either like them or they don't like them, and obviously the division's going to do what their professionals within their ranks decide is in the best interest of preventing placing children in facilities outside the state, hopefully within the state, enhancing treatment for emotional disturbances and substance abuse. So I see this as a very positive step, and I appreciate your service, all of your service, in trying to get more resources for our kids, which I think is the ultimate goal. And I think that by bringing all these perspectives at the top, representing all these different demographic, geographical areas, where one issue may be more predominant in one area than another, that it kind of brings it to the head and really helps guide the division to make good recommendations to the legislature, which can include a BDR. Now, these commissions, I assume, are voluntary commissions, right? So it's not like we're expanding government for the sake of expanding government. These are volunteers that have the best interests of our children at heart and want to contribute as much as they can to try to help improve the quality of life of not only these children, but obviously their families, which you made a very important point, is a nexus point to ensuring that we're embracing good programs for the kids. So is my interpretation right on this? It's voluntary, and these are recommendations. These are not any kind of mandates being placed upon the division.
Chair, through you to Senator Dan Musgrove, absolutely, Senator. And, you know, our relationship with the state and DCFS is actually, and actually Medicaid for that matter, has really grown over the years because they see us as an incredible resource. At the last managed care contract RFP proposal work, they ask us to weigh in. What is it that we need to ask of our managed care companies when it comes to children? And we put together a whole bunch of recommendations, and it was included in the plan. And that meant a lot to us because, again, we're being heard, and I think we just want to make sure that for some reason, sometime in the future, administration changes and somehow we wouldn't get the support to have that statewide consortium that has voluntarily been meeting for over 10 years. So thank you, Senator.
Thank you so much. Any other further questions? Let's move on to support testimony. If you are here in support of this bill, please come forward now. Ms. Frost, you may begin.
Thank you, Senator Doñate and members of this esteemed committee. My name is Shar Frost. I am here today representing the Clark Regional Behavioral Health Policy Board. And I just want to say that we are wholeheartedly in support of this bill. We do really do honor the recommendations of all of our consortia, and especially recognizing that in Clark and Washoe, not only are we dealing with this very large population, but we're also dealing with some very rural populations as well. And so we really do honor each of the consortia, each of their perspectives, and really encourage you to please support this bill. Thanks.
Hi, Sarah Hannanen for the record. I serve as the vice chair for the Rural Children's Mental Health Consortium. I'm also a school social worker out in the rurals, the frontiers. So I get to see these things firsthand, boots on the ground, and work with families. And I am so grateful for the opportunity to be able to work on this consortium because I do feel like it has made a huge difference for our community. And I really hope that you do consider this because I think it will help us bring more of what we're working on to you so we are all working together. We're not working in silos. We're working as a team. Thank you so much.
Hello, my name is Amanda Habush Deloy, and I am the director of the Nevada Institute for Children's Research and Policy at UNLV, but I am not here on behalf of my position today. I'm here as the current chair of the Clark County Children's Mental Health Consortium, and just wanted to provide, again, our support for this bill and to, just as an example, all three consortia worked together today to come up for Children's Mental Health Acceptance Day, and we had a little table outside, and all three were present throughout the day today. And even though there are definitely regional differences, there are issues that do impact the state, like the changes to Medicaid, and we do want to make sure we do have a place to come to communicate, so that way we're all providing input and we're not doing something that's going to negatively impact the other consortia when it's a bill or a regulation that is statewide. So, and I do sit on that statewide group as well as the consortium. I think we try to do the best we can to make sure that we're all communicating with each other and working together. Thank you very much.
Thank you so much. Is there anyone else? Just wanted to give a shout out to Dr. Habusha Deloy. She used to be my former public health professor. So it's nice to see a good go around.
What's your grade?
Anyone else? We don't have anyone else here or in Las Vegas BPS. Is there anyone virtually?
If you would like to testify in support of AB 265, please press *9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Let's move to opposition. Is there anyone in opposition here or in Las Vegas? Seeing none, let's move to BPS. Anyone virtually?
If you would like to testify in opposition to AB 265, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And last but not least, anyone in neutral? Seeing no one here or in Las Vegas, BPS, is there anyone virtually?
If you would like to testify in neutral for AB 265, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. In the interest of time, we'll go ahead and close the hearing, and we thank the Assemblywoman for joining us. So thank you so much. We're going to go ahead and move on to Assembly Bill 202. This bill revises provisions governing the electronic communication of devices in certain healthcare facilities. We have with us Assemblywoman Summers Armstrong, so please begin when you are ready.
Good afternoon, Chairman Donate and Vice Chairwoman Nguyen and members of the Senate Health and Human Services Committee. My name is Chandra Summers Armstrong, and I am the Assembly Representative for Nevada Assembly District 6. And with me today is Jamie Cogburn, who is the President of the Nevada Justice Association, to present to you Assembly Bill 202, which governs provisions regarding electronic monitoring in electronic communication devices in healthcare facilities. Existing law establishes certain duties of a medical facility, including a facility for skilled nursing and specific rights of a patient in such a facility. This legislation is narrowly tailored to allow patients in skilled nursing facilities or their guardian to request installation at their own expense of an electronic communication device. I have a lot more I could say and bring you a lot of statistics, but I would like to read an excerpt from the testimony of my constituent. Her name is Teresa Owens Begay. She is the woman who brought this piece of legislation to me back in probably April of May or 2022. I met her at City Hall in North Las Vegas, and she was adamant and passionate that this piece of legislation come before you. She's working right now, and she can't take off. And so I promised her that I would present to you this bill and some testimony in honor of her brother, who she would like this bill to be named for. As my brother entered his 50s, his health started to decline. He was diagnosed with multiple sclerosis and diabetes. In 2018, my brother suffered several strokes. He was in and out of hospitals. He did not want to be placed in a nursing home because he feared that what would happen to him. Eventually, he could no longer walk, and he had to be placed in a nursing home. His worst fear had now become his reality. 2 weeks into his stay, I started to notice red flags. I would go on my lunch at 10:45 a.m. and feed him. He would have a soiled diaper. He would have soiled his diaper 20 minutes after lunch, and I would call for a nurse to change him. She told me she would have a certified nursing assistant change him. I would return at 11:45, but when I get off work at 3 p.m., I would return to see that he had on the same soiled diaper. You may ask yourself, how do I know it was the same soiled diaper? Because I took a marker and I put a check mark on the tab of the diaper. When I got there, the check mark was still there. That is how I know this happened several times. After he overcame COVID, her brother contracted COVID during the pandemic. I placed him in another nursing home. They had availability for patients who were on Medicaid. I was unable to see him in person because of the lockdown. I would call the nursing home and ask the nurse to put the phone to his ear so he could hear my voice. He needed to know why I stopped coming. He needed to know that Nevada was on lockdown. He needed to know that I loved him very much and was going to do everything possible to see him. He needed to know that there was a deadly virus, but that I would do everything possible to see him as soon as I could. On Thursday, February 4th, I was able to visit my brother through the hospital room window. I remember looking at him, this once strong, vibrant man I used to remember was now reduced to skin and bone. I know my brother endured a lot and his soul must have been tired. I had to utter the words that I never wanted to say. Okay, Hank, it's okay. Go home. Be with Mama. Be at rest. Be at peace. It's okay. 2 days later, on February 6th, he did just that. He went home. He was 61 years old. We would like to start our presentation or just open up. You want to go through the bill? So Attorney Cogburn's going to go through the bill with you step by step. Thank you.
Thank you. Jamie Cogburn with the Nevada Justice Association, for the record. I know we're short on time, so I can run through the bill if you would like. In short, I'll go through it quickly, and I can go through specific sections if there's any questions. But in short, a resident at a nursing home in their room, this would give them the right, if they want, to have either a camera or a recording device, which could vary from a Amazon Alexa device that they can communicate, such as, or an iPad for FaceTime and things like that, or any other type of recording device, so the family and who they designate, and they would have to designate in writing, would be able to access. You have to remember that those in a nursing home, that room becomes their residence. That is their house now. So it is no different than you or I having a camera system in our house, or I have a 7-month-old daughter who I can look at night, even though I'm here in Carson City and she's in Las Vegas, because we have a little camera above her bed. It is all the same things. It allows you to hear, see, and do those things and communicate. That's what this is about. This is their home. They should have that right. And with that, if they request this, it is at their cost. This does not put a burden or a cost to the nursing home or facility. You may hear some opposition that it violates a wiretapping law. It does not. Wiretapping has to do with cell phone communications or telephone communications, and without the party's consent. Here, the person that lives in the room is giving consent. In addition, the nursing home has the right to put up a sign in the door that says, hey, there is a recording device here. With that, I would open it up to any questions or concerns that the committee may have. Thank you.
Thank you so much. Before I turn it over to questions, I do want to thank the Assemblywoman. I received the email for this bill, and I know there was a documentary from Vice News. I'm a big fan of Vice News. There was one that I would implore the committee members to watch, simply because there were several alarming occasions that occurred in Las Vegas from a particular facility where the patient was mistakenly given morphine. And that led to a patient error that cost them their life. And I think it's important for committee members to watch it and to understand issues that are happening here in Nevada. And I appreciate the sentiments of the bill's intention. But I want to go ahead and turn it over to my committee members for any questions. We'll start with Senator Titus.
So thank you, Chair, and thank you for the bill and the concerns and reading the note. Those are all always heartfelt. As most know here, I was our long-term care medical director for over 30 years. During the COVID pandemic, now endemic, the state actually supplied our nursing facility, and I think many, if not all, nursing facilities that needed them with iPads, so that the patients, because it was a real issue for us not to be allowed to have families come into these patients, and so they were able to communicate. So communicating with your family member is paramount to these folks, and whatever that communication is, whether you just can see them or touch them or hear them, it's really important to know that. I worry, though, about this bill, and so I'm asking a specific question regarding most of the facilities now, especially after COVID, have gone to private rooms only. Even the VA hospitals testified in front of us that they're making single rooms now and all those things. There's some language in here regarding roommates and concerns about, the roommate, and I'm specifically looking at page 5, and where the roommate can waive the right to privacy, even if they, an agreement by the roommate or the representative of the roommate to expect otherwise, and that means privacy. And so I worry about that legality and placing the roommate in a position that they feel bad, or do they even have the understanding that this is going on? So just a little bit, is there any protection there for the roommate's privacy?
Jamie Cogburn for the record. I appreciate that question, Senator Titus, and the simple answer is yes. There's actually an amendment we submitted that is a specific form. I believe it was submitted 2 days ago. I did see it on Nellis today, and I apologize, I did not bring it with me, and I think it was 2 days ago. There is a specific form that all patients would have to sign if they are in a shared room, so where there's a roommate. If the roommate does not agree, then the facility would, if they can, accommodate the person who wants to have the recording device. If they cannot accommodate that because there's no other rooms available or they can't switch rooms with somebody, then they would not be allowed the recording device. As for who can sign off on that, it would be the roommate themselves if they meet all the criteria. But if there's a guardianship or some other matter or contingency in place for that other patient, their roommate, then they would have to sign off on it for that to be allowed.
And just clarification, if I might. So you use the term recording device, but really I see this as a communication device. And so there is a distinct difference. And so if they're recording, to me, this is different than hanging a monitor that we're watching our kids at home, or somebody testified that I can look at my child sleeping at home and I can just watch on my phone. And I have a security on my own home, and I can look at right now and look at my house and see what's going on. That's different than a communication device. And so I'm wondering, are you looking at this as something that records the data? Because you use the term record, and then who would keep that and the legality and the privacy issues with that?
Jamie Cogburn for the record, another excellent question. It actually includes both. So it would be up to the patient if they want just simply an iPad, or they want an Alexa, so to speak. There's Alexas that, kind of do the FaceTime device, then that could be theirs. Along with those Alexas, those actually can record also. If they want a recording device, meaning, for example, I gave the one that I use for my daughter, it records, the data then copies over itself after a period of time. The only person that would have access to that data is the patient themselves, or if they authorize somebody specifically in writing. So it's there because they're the only ones being recorded. It's their room. They would be the only one to be able to access that data. So it wouldn't be available, for example, for us to watch here. There wouldn't be a YouTube channel or anything like that. So the data would stay private if they chose to record anything. Many would not choose to record. It gives them that option, and it places no limitations on that.
Oh, okay. So I was just going to interject unless Senator Titus has any follow-up questions as well after my question. So how do you respond to the question of immunity for residential groups? I know that in the opposition letter, there was a request that this legislation should give nursing facilities explicit immunity for the use or misuse of recordings. And so if there is a recording that is leaked online, et cetera, and there's an employee that was in it, whether or not they were acting maliciously, who does that liability fall on? Does it fall on the person that put the recording device in their room? Does it fall onto the liability of the provider group? How does that conversation align with what you're proposing?
Thank you. Jamie Cogburn for the record. As it stands, the nursing home would not have access to the data. So the nursing home would not be able to leak the data, so to speak. The patient is the only one that could release that data. As the bill is written, You see in there if there's violations, for example, if the nursing home takes the camera and turns it away from the person. For example, some families are just concerned about the safety and welfare of their loved ones. And they go, hey, I would feel more comfortable, and the patient, the loved one would feel more comfortable if there was a device, whether it records, whether it doesn't record, that somebody could peek in and see. We refer to it as nanny cams or, things like that. So the patient is the only one that has access to the data. I assume it is possible that somebody could be hacked and those type of things. That is not without question. But the patient is the only one that has access to the data. The nursing home would have no liability because they're not in control of it. They don't maintain it. They don't do any of those things. And in fact, in other states where this has been enacted, it is recommended, because not all nursing homes have Wi-Fi, that sometimes the patient acquires a hotspot, so to speak, or through I'm not sure how they work, frankly, but a hotspot like your cell phone would work that allows you to do it, because they cannot rely upon the Wi-Fi in the facility at times. And again, the patient is the one who bears the burden for the cost and to make sure that everything works and any expenses that go along with the device. The only thing that the nursing home is responsible for is helping make sure that if it's pointed there, they can't move it so it is no longer accessible by the patient. I hope that answers the question.
Yeah, it does for me. So, I mean, the only thing that I would think of would be, and perhaps I'm not seeing this in the bill language, a situation where the residential facility group would have to establish, or maybe it could be accomplished through this NRS statute, that it has to be on a fixed location, because I know that cleaners come in all the time, the CNA may come in to turn the patient over, God forbid the camera knocks over, and now they're causing a whole liability issue, right? Which is not the intention of anyone. So if there's a policy that could be put in place that these are the type of cameras that are of use if you want to participate in this, and that it has to be in a fixed location, right? I know that we'll have, and my colleagues will probably have questions as to the recording versus monitoring, and so I'll let them ask those questions, but that was just my main worry. And I know that this is one way that you can look at, and I know that there's other states that have passed it, but I just want to make it clear that there are also other ways that you can detect abuse with patients. Bed sores is the easiest one, bruises, et cetera, and so I just wanted to put that out there. But Senator Titus.
Thank you, Chair, for the follow-up question. One of the questions I was going to ask was that federal standards, we're so regulated in the hospital situation, not only by state regulations, but by CMS. And so where does the federal government give us any guidance in our long-term cares on monitoring?
Jamie Cogburn, for the record. Not that I'm aware of. I'm pretty familiar with the CMS guidelines and the regs. I happen to practice law in that area of medicine, or that area of law. I'm not aware of any off the top of my head. A lot of it becomes state regulated. So even though there's the federal regulations, it's left to the states if there's supposed to be a ratio for, patient to nursing ratio and other things like that. There's recommendations by CMS, but there are no mandates regarding, especially this area, that I'm aware of.
Thank you. And I stand corrected. Our legal counsel did mention that the bill does say that they have to be in a fixed location, but it has a subset B. So I think we'll talk more after this hearing as to what the sub B looks like. Senator Stone.
Thank you for the presentation. I'm concerned about the recording devices. So you have medical personnel that's coming in and performing some very delicate, intimate tasks that are going to be captured on a camera. Sometimes a recording only tells part of the story of what's going on. I know that there are some statutes that you have to get permission to be recorded. So would the employees of these homes have to sign some kind of a release saying that they know that they're being recorded and they have to agree to be recorded in order to be providing treatment for the prospective patient?
Thank you, Senator Stone. Jamie Cogburn, for the record. The short answer is, as to the employees, no, they're not required to have a release. As part of, they work there. Frankly, at most facilities, there's already cameras in the open hallways, considering the public area. This would be in the private room. In the bill, and I forget the exact number, I think it's section 13, it does allow them to place a sign to let them know that there is a recording device.
Okay.
Now, as to the concern of stopping the recording because there's something private going on, they would have the ability to do that. Again, it would be up to the patient, but I'll use this as an example. Let's say a CNA comes in to help the patient go to the bathroom. One, the device cannot be in the bathroom, but two, if the patient says, hey, I would like you to turn that off because I don't want somebody to see me because my gown may be open or something to that effect, then they can do that. Ultimately, the patient themselves kind of controls that and regulates it. It's what the patient feels comfortable with. Again, we're going back to, it's not like a normal hospital where it's just a room. This is their residence at that point. They're living at these long-term facilities for usually the rest of their life because they've decided, their family has decided, they've decided that's what's best. My grandma lived in a facility for 28 years, started in a little apartment, and then it went to a little more secure, and then ultimately it went to a dementia unit, so people, don't leave because of the dementia. It is to make them feel comfortable. I think COVID brought this out even more because, as Dr. Titus indicated, or Senator Titus, apologize, indicated, these family members need that warmth, love, touch, and not always is their family local. So this also allows family members that may be on the East Coast or California who can't get out there on a regular basis to just touch in and say, hey, hi, and really kind of check in as long as the patient, if that's their desire.
Thank you.
Thank you so much, Vice Chair Nguyen.
Thank you. I know in looking in some places like Texas, this has been a law for like 20 years. And I'm just curious right now. I have an Alexa in my office here. I use it to communicate with my kids, but I know it's constantly recording because just like my phone is recording me, it's recording me right now because if I start talking about something, it's going to pop up on my phone minutes later in all the advertising. So I know that they're always listening to us, and that's the way these devices work. If I was to say Siri loud enough, I bet half of our phones might respond. So how is this different than under current law? The way we have it right now, can people that are in their homes in these residential facilities not have a cell phone, not have an Alexa, not have any of those devices?
Thank you. Jamie Cogburn for the record. Senator Nguyen, that is an excellent question. Actually, they can. It's that many facilities do not allow them. So the facility can say, hey, we don't want you to have that, and so we're not going to give it to you or allow you to use it. This would say if the patient wants it, they must be allowed. Or the facility must at least make a reasonable accommodation. Again, we get into if there's two patients in a room and one patient doesn't sign off, then okay, you have to accommodate both people and do the best you can. But it's really the facility that's denying that right now.
Do you know if they're denying everything? It got me thinking about everything that's listening to you in this very room. Your phones. My toothbrush has one of those devices that reports information back to Sonicare how often I brush my teeth. There is so many things collecting data on us at all times. So are people that are in these residential communities so isolated that there are places that don't allow them to have laptops or iPads or Alexa? Those are all recording communication devices. I don't know of a Ring Cam or a dash cam, or my kids have little fun spy cams that are in USB drives that record it's scary out there, but I'm just wondering if there are places or there are facilities that are just prohibiting all forms of communication that we have grown accustomed to in this society, even post-COVID, but definitely after COVID.
Jamie Cogburn for the record. I don't believe I'm not aware of any facility that limits all devices. So I believe, and I want to say this, I believe most facilities are good. So there are always a few bad apples, just like everything. I have had experience where we've told people to call the ombudsman because they kept turning off their Alexa and they wouldn't let the person use the Alexa. And I can tell you ultimately, That person downloaded what was on the Alexa, and it was her husband screaming for help hours and hours at a time. So, you know, different facilities operate different ways. I believe in general, most facilities are good. They do accommodate and allow at a minimum phone calls and things like that. But many of these people need help because they cannot get out of bed. So if it is not within arm's reach, they are not able to do anything. So they can't pick up an iPad. Many people at that age don't know how to use an iPad, so they need help on those type of things. So it varies from facility to facility, but ultimately the facility does govern and control what happens.
Any other questions? I think my only request is for the conceptual amendment. If this form could be just adding one sentence that says if the patient speaks a different language, that they'll make appropriate accommodations to translate it. That would be my one request. But I think we're good for now, so we'll move on to testimony and support. If you are in support of this bill, please come forward, both here in Carson City and Las Vegas, and we'll open up support testimony. And we will begin when you're ready.
Okay, good afternoon, Chair and members of this committee. My name is Catherine Nielsen, and I'm actually representing myself and my family today. My comments will be short. My husband Matthew is 33 years old and is in the beginning stages of developing a disease rather similar to frontotemporal dementia. Some of you may be familiar with this terrible disease as the one that Mr. Bruce Willis was recently diagnosed with. During the stages of diagnosis, we required video documentation to assist the medical team in their assessments. Many patients have seizures and other ailments that go along this degenerative brain condition. For many families, this diagnosis means a likely nursing home placement at some point in their life, which means many people will be away from the ones that they know and love. When my husband is exhibiting symptoms or has just had a seizure, my face is the only one that brings him back to us. For those like my husband, cameras and video screens could help alleviate or calm many situations. This condition can also come with behavioral changes that are outside of the patient's normal behaviors. Placements of cameras can also provide protection to staff just as much as patients and family. In conclusion, not only would cameras assist in diagnosis and medical care, but the safety of patients receiving the care and staff providing the care. Thank you.
Thank you so much for sharing your story. Anyone else in Carson City or Las Vegas? DPS, let's move to anyone virtually, please.
If you would like to testify in support of AB 202, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Anyone in opposition, please come forward. And please begin when you're ready.
Chair Doñate and members of the committee, for the record, my name is Brett Salmon with the Nevada Healthcare Association. We represent nursing facilities and assisted living facilities throughout the state. We are currently in opposition to the legislation, and I just want to make it clear that we're not opposed to residents being able to communicate with family members. It's more the unintended consequences that how we see the bill currently. That it might have on how we operate, and so that's the point I want to make today. We do feel that based on Nevada case law that went before the Nevada Supreme Court in 1998, that we do have a wiretap issue, and that liability shifts to us. We believe that that's not addressed in the bill because the electronic devices that would be in these facilities that would record conversations require explicit consent under that case law. And as a result, we believe that shifts liabilities to us. And I'll speak a little bit more of that at the end of my testimony. As per the issue of where the device should be placed, the language in the bill says it should be a fixed viewpoint. We think that could be clearer where it should be affixed as well as in a fixed viewpoint. So so that the actual device cannot be moved. So not only can you control the field of vision in the device, but also control that it cannot be moved or jostled or, unintentionally moved, and then, the roommate gets put on the camera. So the issue in the legislation too that concerns my members is that where the language in the bill in Section 13 says that it would prohibit a facility employee from refusing to enter a room where the devices are being used. We believe that we can manage our employees. If there is an employee that has a particular reason why they don't want to be recorded, we believe we can handle that and we can accommodate that, and we'll just not have them go to that particular room. And we think that having an amendment that would address that would be a pretty easy fix. The last item that I'll address in my testimony today that's in my letter is just on the overall immunity. So in Section 9, it has a waiver of liability for the residents and the roommates' violation of their privacy as it pertains to these electronic devices. And that applies to the facilities and also applies to the employees of the facility. But we believe that, that grant of a waiver of liability immunity needs to be a little bit clearer, because it could also impact physicians, hospice workers, rehab workers, transportation workers, and other people that might be recorded. And then circling back to that wiretap issue that we're concerned about, because there wouldn't be explicit consent for those people to be recorded, we believe that liability lands on us. If that can be addressed in the legislation, then obviously we don't have a problem. And per the questions about video monitoring as opposed to recording, that's a different thing under Nevada law. Video monitoring is not an issue under the wiretap law. Where it's recorded, then it comes into conflict with that particular Nevada case, and so that's the point that we're trying to make. Thank you for your time.
Thank you so much. I think we have a few questions, so Vice Chair Nguyen.
Thank you. You had mentioned something. I frankly, I disagree with your assessment of a 1998 case,
Okay.
pre-Alexa, pre-cell phones, pre-iPhones, pre-anything, pre the birth of our chair. No, very close, right? Very close. I just, the liability issues, like how do you deal with that with other like personal effects of like a person?
Brett
If
Simon
they
for the
had
record.
like a CD player or a DVD player, which don't even exist anymore, or a laptop or any of those kind of things, and they fell over and they like, do those change the practice of the people in the facilities? Like the workers?
I don't, Brett Simon for the record, I'm not sure I understand your question. Can you help me understand that better as it pertains to people falling or?
I guess I just don't understand what the objection is to having people be able to record or have these devices that are able to communicate. And I'm not sure where you see the line where someone can have an Alexa, or can they never have a situation where they have an Alexa, because that device is always recording. It is always on. Your cell phone is always recording as well as it is always on. Like, do you not allow those kind of telecommunication? Like, do we only have landlines in these facilities?
Brett Salmon for the record, and Senator, no, we have those devices in our facilities, and people use FaceTime and they use Facebook, and they do all those things with their devices currently. The issue that we're being advised with our council is that based on that law, and you're right, I mean, maybe it's dated, but that's how they interpret it, is that the argument that they've made to us is we have a very similar law to California. And the way California handles this is they don't, it is an optional requirement, not a mandatory requirement. You can't mandate it because of that provision. And so that's how California, I realize different case law, but that's how they deal with it in their facilities there. And so that's the advice that we're receiving, that liability is there for us, and we just like to find a way to address that.
I guess you would legislatively through like a piece of legislation like this. I mean, if Texas has had like a similar statute in place for 20 years, they obviously sought to put it in statute. And if there was case law that overturned that, that would happen. So wouldn't this fix your your case law issue that you have from that 1998 wiretapping like interpretation?
Brett Salmon for the record. And Senator, I think the concern that we have is how that applies back to, as I was citing, the other people that are involved in this. So the language there in Section 9 that grants us some waivers, we think that needs to be broadened. And I think it does address it if we can broaden that language a little bit.
Did you have any other questions? We did have a clarification from our legal counsel regarding the case law, so please proceed.
Yes, Eric Robbins, LCB Legal for the record. So, yeah, our, I guess, opinion on this is that there would be no conflict with wiretapping laws. We feel that first of all, as has been pointed out, the law and the case deal with telephone communication. In this case, it would be it is a communication device or a recording device where both the resident and the person on the other end would have consented to the recording, so you have consent on both ends. As far as the nursing facility, they are regulated facilities, and basically what this bill is saying is that the nursing facility has to consent as a condition of operation in this state. And then also, I would say that basically courts generally construe statutes to agree with each other. And the legislature has the prerogative to enact statutes that lessen the applicability of other statutes. And to the extent that there is a conflict, you would basically be having one statute, the statutes in this bill that would basically be rendered moot by the NRS 200.620, and that's an absurd interpretation that we don't believe any court would ever embrace. Instead, we believe a court would, to the extent that there is a conflict, which we don't feel that there is, that a court would construe the statutes harmoniously and give effect to each statute.
Thank you so much. Vice Chair Nguyen, did you have any other questions or any other committee members?
Yeah.
Senator Titus?
No, I don't have a question. I have a comment about that. We were just chatting here that one of my concerns about the bill is the liability issue for employees, people coming in, the cleaning women, all that, and recording them. And on Section 13, it says that they may post notice. I mean, I don't believe in you're secretly recording people. That I have an issue. I mean, I let all my patients have their cell phones, and literally I had patients call me on their phone, and my nurses would get me out of my office to talk to this long-term care patient because she ran out of her port, and she wanted me to buy her some more port. So, and this is true story. So I was very responsive to my patient. I did, of course. That was her. Instead of taking a drug at night, she took a shot of port. I'm good with that. So anyway, my point is that I worry about the liability and employees' privacy, other roommates' privacy. So if this was to happen in facility, I think it has to be posted that there's monitoring in place. Not may. It must be.
Thank you so much. Any other questions or anything? No? Anyone else in opposition? Seeing none in Las Vegas or here in Carson City, BPS, is there anyone else virtually?
If you would like to testify in opposition to AB 202, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Anyone here in neutral, please come forward. Anyone in Las Vegas, BPS, anyone virtually?
If you would like to testify in neutral for AB 202, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Assemblywoman Summers Armstrong, did you have any closing remarks or clarifications?
Thank you all so much for your time. I just want to clarify, I'm going to talk about the employee privacy. I spoke to a representative from one that represents two of the largest employers nationally about employee privacy. And they informed me that companies like Walmart and TJ Maxx and others do not request their employees' permission when they are in the work environment. They have cameras everywhere. And I asked, what they did, and they said, we have cameras and they're up there. And the employee is not asked their permission to do so. But there are signs that say that they are under.
Right, thank you for that, 'cause
Yes.
if I might, because that's exactly my point, is that I didn't say you have to ask the employee permission, but they should be notified that the recording is in progress. Or there's a monitor there. That's my complaint. We know, as my senator to my left here said, we're being recorded all the time. But we're aware of that. We're being recorded right now. But when you walk into a hospital or a patient's room, record cameras in progress, and they know that Walmart employees know they're being recorded. So I have no problem with the recording. I think it's just a notification.
Thank you, Senator Titus, Chandra Summers Armstrong, for the record. Yes, ma'am, I agree. I will work with, we will work on this issue of notification. Shall. Thank you, ma'am.
That's easy.
Thank you so much. Any other comments? I think we're good. So we're going to go ahead and close the hearing on this bill. We thank the Assemblywoman for joining us, and we'll move on to the final bill, Assembly Bill 311. This bill revises provisions governing health care. We have with us Assemblywoman Bilber Axelrod, so please begin when you're ready.
Thank you, Chairman Donate. I see my co-presenter on Zoom. So thank you. Good afternoon. Chair Donate, members of the committee, Senate Committee on Health and Human Services. My name is Shannon Bilber Axelrod, and I represent Assembly District 34 in Clark County. I'm pleased to come to you today to present Assembly Bill 331, which allows a greater number of Air Force medical personnel to serve in our Nevada hospitals. This bill will help to address the healthcare provider shortage we are constantly discussing in this building. To provide background on this topic, it's important to discuss the Las Vegas Military-Civilian Partnership. Such partnership place active duty military personnel into local civilian trauma hospitals to maintain their clinical proficiency and provide medical care to the community. The Las Vegas Partnership is the largest and most integral program in the country and has supplied much-needed healthcare personnel to the University Medical Center, Veterans Administration Hospital, and the UNLV School of Medicine. They have also worked in several other Southern Nevada facilities. This partnership has steadily grown and achieved its goal of preparing Air Force medical personnel for deployment. But Nevada law currently stunts the growth of this program because it's currently limited to armed forces medical officers only. Assembly Bill 331 solves this problem by increasing the number of Air Force personnel who would be permitted to serve in Nevada hospitals. I'll now turn it over to my friend, Dr. Jeremy Kilburn, who is joining us from his hotel room because he's on paternity leave because he has a brand new baby girl. Dr. Kilburn is a critical care doctor at UMC and a colonel in the United States Air Force. He also saved my husband's life, so he's a pretty good doctor in my opinion. He'll give you some additional background and context of why this bill is needed.
Thank you so much, Assemblywoman Bilber Axelrod. And thank you, Chair Donate, for the privilege of being here. The Las Vegas Military-Civilian Partnership has been steadily growing for the last 20 years. Originally, this was made possible by NRS 4492455, which allowed for the portability of licensure for medical officers who had licenses, so doctors, pharmacists, nurses, to work in Nevada hospitals. And then as this has grown, there's currently over 100 nurses, doctors, residents, fellows, technicians, all active duty working in our principal location, which is UMC Hospital. But as we've grown, we've struggled with our ability to involve our enlisted technicians in the hospital. This prominently took place during COVID, where I had difficulty getting our Air Force respiratory therapists into UMC Hospital to help with contingency COVID operations, because, you know, where many military medical personnel deployed during COVID, us in Las Vegas, a lot of us deployed in place and worked at UMC and really helped kind of, I think, prevent a lot of medical collapse, frankly. And so when we look at Las Vegas as being medically underserved, it's just a perfect fit for the Air Force to partner with Nevada and with University Medical Center specifically as our primary hospital partner, and UNLV School of Medicine is our primary academic affiliate, to get our medics the exposure that they need to critical illness and to also help the citizens of Nevada. So, you know, I just can't thank Assemblywoman Bilbray Axelrod enough for the opportunity to be here. And I will be happy to answer any questions you might have. Thank you. Over.
Thank you so much. I just have a quick question. I know that our committee members or committee staff are trying to print the information. We actually received an amendment earlier today from, not from you, Assemblywoman, but from the National Center for Incompetency Testing. And I believe they were requesting an amendment on one of the subsections. Are you aware of this amendment request, or?
I am not aware of this.
Okay, well, I just wanted to double check in case if it had been recommended or introduced, but just wanted to get that clarified before we ask our questions. All right.
Thank you, Chair. No, this is the first time hearing from it. In fact, this is its first reprint, but the amendment initially was just to add co-sponsors.
Oh, thank you so much. All right, Senator Titus.
Thank you, and thank you for bringing this bill forward. I think it's a good bill. I just want some clarification, however. I trained in Reno, and I did much of my work and was the medical officer of the day at the VA hospital frequently. We worked with a lot of docs there and other healthcare providers, nurses, the whole pendulum of healthcare providers, from lab techs, et cetera, that weren't Nevada licensed providers, lab techs, nurses. They were all licensed through the federal process, and somewhere they had to have a license, but so they don't have to have a Nevada license. So I just want to make it clear that this just isn't for the down in Clark County and the Air Force, but reality, veterans, people who work at the Veterans Hospital could serve in this capacity also, because I think it's a great idea. For me, it really goes along with what we've already talked about many times in this building, is reciprocity. So across the spectrum of healthcare providers, and the VA, not just an active military basis, but the VA also has these providers. So wanting to make sure, I don't see anything in here that's limits to the Air Force. The comments were about the Air Force, but I want to make sure that the federal government is licensing these folks, and they may practice at a VA, they might be on a base, they may be in Fallon at the Naval Air Station. So just clarification that it would relate, and you're anticipating all federal employees, regardless of active or veterans, this would affect that.
Shannon Bilbray for the Axelrod for the record. Absolutely, and this was talked about a lot on the Assembly side, that it's enabling language. We just happen to have a really amazing program down at UMC,
Okay.
And that's how I became aware of this. Dr. Kilburn, did you want to add anything?
Yeah, so certainly I think that this should apply to all active duty. You know, that the issue is, as Senator Titus said, you know, for federal employees. So when we have licenses, nurses, doctors, technicians, under USC 1094, there's portability of licensure. Then Nevada, like I said in the early 2000s, you know, passed an NRS, which also allowed for portability of licensure for medical professions, the armed forces. So the issue that we're having here is that the federal government is not necessarily requiring respiratory therapy, would be the example, does not require respiratory therapists in the United States military to have licenses at all. They have to have either a CRT or increasingly a registered respiratory therapy certification that's registered nationally, but they don't require a license in any state. And so that's my impetus behind, this legislation is that it's for the members of the armed forces that don't have federal or that don't have a license in any state because their federal job does not require them to be able to practice to their federal scope in Nevada hospitals as part of a training program for currency and competency, whether reserve or active duty. So that's kind of how I see the bill and where the need was kind of garnered from. Over.
Follow up on that? So from what you're saying, and thank you for that, from what you're saying, then it wouldn't apply to the folks who work at the veterans hospitals because they're not active military. And so, but they don't have Nevada licenses either. And so I was just trying to get some clarification on that. So this
Yes,
bill.
ma'am. Jeremy Kilburn, for the record. So I'm just kind of, because this has been my whole life for 10 years. I've been directing the Las Vegas Military Civilian Partnership. So in my opinion, that would have to be separate legislation, which I think would be amazing and awesome. And that would be more portability of licensure. What this bill deals with is the absence of licensure.
Okay, that's a distinct difference. So thank you for the clarification. Thank you.
Yes, ma'am.
Vice Chair Nguyen? Any other questions? I feel like I'm having deja vu on this issue. I'm trying to compare back to there was an amendment that was, just for clarification, there was an amendment that was sent to us trying to not address the language that you have, Assemblywoman, but it's one of the earlier NRS provisions, but because your bill opens up the chapters, they're requesting to add more requirements as to what's considered a surgical technologist. I'm having deja vu because I feel like it's happened in other occurrences with a similar issue. So it's not you specifically, but that's why I'm a little bit flustered.
Chair Donate, 'tis the season for that to happen.
Tis the season. Tis the season. All right. I don't think we have any other questions, so we'll go ahead and move on to support testimony. If there's anyone that would like to provide support for this bill, please come forward
We
now.
might have someone on Zoom. Dr. Kilburn, are they calling in? Maybe they're calling in.
Jeremy Kilburn, for the record. We had someone from University Medical Center, but they couldn't make it. Over.
Thank you so much. All right. So anyone that wants to testify in support, please come forward here or in Las Vegas. Seeing none, BPS, is there anyone virtually?
If you would like to testify in support of AB 311, please press star 9 to take your place in the queue. Caller ending in 250, you are unmuted and may begin when ready.
Hello. Can you guys hear me okay?
Please proceed.
Yeah, thank you, Mr. Chairman and members of the committee for the opportunity to comment today. And for the record, I'm Dana Van Lees, the Senior Vice President of Government Affairs at the National Center for Competency Testing and NCCT. And we actually support AB 311 if amended to include both equally accredited surgical technology certifications, as mentioned in previous correspondence to you, NRS 449-24185. And we agree with the gentleman from the Air Force regarding his concerns, and unfortunately they are not unique to Nevada. There's a lot of nuances in this, and when you choose to regulate fields that largely go unregulated, this is kind of what other states run into as well. We do a lot of work with the military. So that aside, I emailed the committee with proposed language and details, and I won't recap those out of respect for your ball game schedule, so you all have time to stretch properly. But to support the healthcare workforce, and specifically the surge techs, these amendments accomplish two crucial objectives. What they do is they remove current roadblocks to recruitment and retention of qualified and competent surgical techs in your healthcare facilities, which is also what your military edition does. And they improve and protect the sustainable future of this workforce by recognizing legitimate and safe pathways to becoming a surgical technologist, which includes your military and apprenticeship training and other types of training that don't have to be an accredited program that I can explain to you in another time if you'd like. But we all know that healthcare in general is experiencing unprecedented workforce shortages, and it's in the best interest of all involved to avoid imposing restrictive laws and regulations. And so I sent you links to show how Oregon and Virginia corrected their code to fix the same unintended consequences that you guys are experiencing here, so that you can see that this is a valid and legitimate concern in this field in general, not just your state. But here's what's happening. Similar restrictive legislation is getting systematically introduced state by state, and they're purposely naming only one of the two equally accredited certifications. And so this creates a de facto monopoly that unfortunately creates a bottleneck, which accentuates the workforce shortage in an already stressed medical system. And it exacerbates the existing staffing shortages by creating more roadblocks for employers to recruit and adequately staff their operating rooms by limiting qualified practitioners' ability to practice. And some of those are our military individuals as well. So there are currently only two equally accredited certification exam programs for the field of surgical technology.
Thank you so much, ma'am, for your
The
comments. If you can please
national-
wrap them up.
Yep. The NCCA is who accredits us. And so all this proposed language keeps open all these for the stakeholders, and I'm happy to answer any questions and have fun at your ball game.
Thank you so much. BPS, is there anyone else?
Chair, there are no additional callers at this time.
And just to clarify, the last caller should be noted as neutral because they had a conceptual amendment. So, moving on to anyone in opposition. Is there anyone in opposition in this room? Seeing none here or in Las Vegas, BPS, anyone virtually?
Chair, there are no additional callers to testify at this time.
Thank you so much. And last but not least, anyone in neutral on this bill, please come forward. Seeing none here or in Las Vegas, BPS, is there anyone virtually?
Chair, there are no callers choosing to testify at this time.
Assemblywoman, do you have any closing remarks?
I know you guys got to get to the softball game, and I'll be there to cheer on for everyone. But no, I thank Dr. Kilburn for being here. We did have quite a few people who were calling in to testify, but that's okay. We're a third bill, and I will look at this amendment. We're just kind of up against deadline, but thank you so much for hearing this bill.
Thank you so much. I would urge the Assemblywoman to cheer for the Senate. Otherwise, we would have to reconsider passing the bill. Thank you so much. We'll go ahead and close the hearing. We'll move on to last agenda item, which is public comment. Anyone here or in Las Vegas? BPS, anyone virtually?
If you would like to provide public comment, please press star 9 to take your place in the queue. Chair, the lines are open and working, but there are no callers at this time.
Thank you so much. That concludes the business of today, and we'll see everyone next Tuesday. Meeting's adjourned.